The goal is clear: creating a healthcare system that provides integrated care. But how do we get there? Melissa Mahadeo took a look at one firm in Georgia that brings together finance, personnel, IT, and more.
Healthcare systems are facing a myriad of challenges these days, from finding the right personnel to changing technology. I came here to Atlanta to speak with the folks at Coker Group to find out how they're helping healthcare providers navigate through these changing waters.
20% reduction in RV.
At Coker Group, we help healthcare providers, which I would include primarily as healthcare systems, hospitals, and medical groups, to develop a strategy for dealing with the extraneous things going on in healthcare today.
The major challenges facing healthcare today have to do with the attempt to simultaneously improve quality of care in the American healthcare system and also lower cost. To do both of those at the same time is a huge challenge.
From structuring transactions, structuring working relationships, negotiating transactions, putting in good IT systems. We provide financial advisory services, and then even helping them recruit and procure competent staff.
95% production, 5% performance.
The IT service line is primarily working with hospitals and physicians in their quest to modernize themselves, whether that's through the acquisition of new software or hardware or various strategies that involve interoperating with other health systems or connecting. I think knowing that we are truly objective, non-biased, no financial conflicts, that we absolutely represent the hospital, the physician, or the buyer, which is in both cases they would be. So I think a lot of times we get asked to be involved because the client knows that A, we're representing their interests, and B, if the vendor does not deliver as promised, we'll be there standing with them shoulder to shoulder.
We always want to see our clients succeed. To us, that's of vital importance, and that's why we're in the business.
Some of the things that make Coker really successful, in my opinion, are the teamwork among not only the senior leaders, but also amongst the staff members in the different divisions and departments. I think one of the other things that differentiates Coker from other advisory firms is that senior management pays a lot of attention to the clients. So in other words, you're not going to get saddled with a junior level associate who just came out of grad school who wants to work on a project. You're going to get a senior leader touching something in your project or ultimately managing the project, and that doesn't necessarily happen everywhere.
I'm thinking of one hospital client that had issues across the board. They had financial issues, they had operational issues, they had clinical efficiency issues, they had all kinds of problems that they were facing. And we went in and did a wholesale turnaround effort. And so it took the course of 12 months for us to really touch all the areas that needed improving. But at the end of the day, they were able to see a return on investment. We really work with them to make sure that they are successful over the long term and not just a patch or a quick fix.
Our ultimate goal is to create a transparent buying situation so they have all the information they need, they know the costs, they know the risks, but more importantly, they have all good options to choose from. There's not a good or bad decision.
The hope I have for the future of Coker is that we continue to maintain the standards, the ethics, the high professional bar that I believe we have set for ourselves to always exist long after I'm gone.
It's similar to the old Wayne Gretzky quote of don't skate to the puck, skate to where the puck is going. Anticipate the future and help clients to meet the challenges that we see ahead in the industry.